Tonight, paying to escape a 7 million long NHS waiting list.
I'm physically at my lowest point. I'm buying back my life.
Record numbers buying healthcare here and abroad.
70% of our patients are coming from UK. Feel desperate because we cannot get help.
A once simple operation now life-threatening after years of waiting.
I have deteriorated. There is a risk it would kill me. That's why I feel let down.
And buying treatment because delay could cost more.
If I'd waited for the GP, I wouldn't be here to tell my story.
Do you feel like the country's sleepwalking into a cancer crisis?
We're already in it. This is the worst cancer crisis of my lifetime.
Good evening and welcome to the Tonight programme. Over 7 million of us are on the NHS waiting list. That's 7 million stories of fading health, pain, and sometimes the feared treatment may come too late. Some experts warn of a deadly toll. So it's perhaps not surprising that there has been a record surge in Brits paying for private healthcare, both here and abroad. Tonight, ITV's health editor Emily Morgan meets some of those selling homes, taking loans and fundraising to buy back their health.
As ITV's health editor, I get a frontline view of the NHS in action.
They are doing everything they can.
I witnessed a nation indebted as we prayed for the pandemic to end.
For every COVID patient that ends up here...
But as COVID subsided, a new, some say just as deadly, battle began.
Have you ever seen a waiting list like this?
No.
It's horrendous. There are patients on my list that have been waiting from 2019.
As hospitals back up, UK-wide over 600,000 are stuck on waiting lists over a year long.
I think lives are being lost, yes.
Tonight, I'm on a journey to meet those unwilling to wait in pain or live in fear the treatment may come too late. They are all digging deep, going the extra mile to buy back their health. Record numbers of Brits are being forced out of work due to long-term sickness. This Welsh nurse is just one of them.
I've got sharp shooting pain in my groin that just makes you stand still. And then I've also got the feeling that the leg is going to collapse.
Employers said Candy's disability placed patients at risk, putting her out of NHS work and onto its waiting list.
I was told quite clearly hip replacement is the only option. It'll be 2.5 years. I don't want to stop working yet.
Candy's local health board say they are working hard to reduce such delay, but over 40,000 like her across NHS Wales are waiting over 2 years.
I can't walk properly. I'm financially at my lowest point. I'm physically at my lowest point. I'm emotionally at my lowest point. I don't think I've gone this low.
The choice is simple. Wait or join thousands paying up to £13,000 for private hip replacements.
It is a problem to be able to afford it, and I've got to say, the family's fear of me being dependent on them has forced them to empty their pockets, and they're helping me out a great deal here.
But even private hospitals had a 4-month waiting list. With money tight, Candy found cheaper options in Lithuania.
It's half the price, and I couldn't believe that. And then you got to ask yourself, you know, to get what you pay for, and a bit of fear there. Am I going to wake up dead? Being a health worker myself, I never thought I'd be looking elsewhere. I'm buying back my life.
We'll rejoin Candy as she makes that 1,000-mile journey to Lithuania. As Candy joins the thousands paying for treatment, our hospital surgeons are seeing the impact of delays.
If patients wait longer, then they actually deteriorate during that time. So waiting is not just a matter of staying the way you are, but it's also a matter of getting worse whilst you wait. And of course, this can be true of the cancer area, which surgeons deal with too.
Here in the UK, private hospitals like this one, run by Spire, have seen a whopping 81% increase in revenue from people paying for their own care. And many of their new patients have never considered depending on anything else but the NHS.
Brilliant. I can walk and I've got my life back.
People like Julia, who paid £13,000 for a hip replacement when the NHS couldn't even give a date.
You don't get time, you don't get a month, you don't get a year, so you're just left.
By going private, what did you buy back?
I bought back my life. I had 2 small children and I worked full time. I was in pain daily, I couldn't sleep, I couldn't get up the stairs. And I always remember my 4-year-old said to me, "You walk like all the normal mummies now." And he just looked really happy because he could see that I wasn't in pain anymore.
A visit to see a Spire GP here in Manchester costs £110 for 30 minutes. Any tests and specialists cost extra.
Anya, hi.
Anya is one of their GPs, but she also offers 10-minute slots in her separate NHS practice.
Why would they come to you as a private GP and not go to an NHS?
They may have gone to NHS GP first, they may feel unsatisfied, but I have more time to explore things. I saw a 60-something-year-old gentleman who had weight loss and significant weight loss, slightly altered bowel habit. I was able to get bloods the same day as I saw him again 3 days later, got him an appointment to see a specialist that night, a general surgeon. And he subsequently had a scan and it looks like esophageal cancer.
Talk to me about the difference between referring people.
Frustratingly, and the latest figures that were shared with me in my NHS capacity, and those referrals are taking up to 2 months now. And that is just horrifying for us.
And how does that make you feel?
That's rubbish. Sorry. Yeah, it makes me sad. That's my loved one. You want them seen.
Buying private care doesn't come cheap. Nearly 500,000 of us have taken out medical insurance in the past year. Uninsured, the average UK price for a colonoscopy is around £2,000. Cataract surgery, nearly £2,800. Just under £13,000 for a hip replacement, £14,000 for a new knee, while an MRI to help diagnose cancer could cost £890.
I have terminal brain cancer, and that gives me 3 years left to live.
For some, the only way of buying healthcare is to fundraise online.
There are just so many of them.
I did set a £5,000 goal as just
There's been a surge of medical appeals on GoFundMe.
Since we launched in the UK in around sort of 2017, we've seen roughly a 5 to 6-fold increase in our general medical category.
Thank you so much for your amazing help.
Severe gallbladder pain and NHS backlogs halted Christina Johnston's opera singing career and income, forcing her to raise £7,000 for an emergency operation in the UK.
The pain is so intense that I would have preferred to die. If your gallbladder bursts, it's deathly. I'm on the emergency list, which I thought, wow, that's amazing. But he said, unfortunately, there's going to be another 3 months wait for that. If I don't sing and I don't perform, then I don't get paid.
Sounds really good.
Never, ever would I have thought that I would need the charity, and that's quite a humbling thing.
In weeks, Christina raised the money.
Just come back from surgery. It's over and I'm really happy it's done. So, yay.
1,000 miles away, Candy has arrived in freezing coldness, Lithuania.
Where's my skis?
She's eager to meet the surgeon who will do her hip replacement for £7,000, around half the UK price.
Hi, I'm Linus.
I'm Candy.
Nice meeting you. Please, Sit down.
Surgeons here are witnessing the damage of delay.
The longer you wait, the more problems we will get as the surgeons and you as the patient. Because your rehab will take longer, our surgery longer, and it can be for us much more difficult to restore your joint anatomy. So after the surgery, the pain will go away.
Here in Colness, several clinics compete for this booming British business. It's all EU regulated and already well established in cosmetic surgery. Most here, like Bronwen from Dorset, applied using their NHS X-rays.
The last year we did 520 orthopedic procedures, and 75% of those patients are patients which are coming from UK.
Yeah. It's good business for us, but you know, we're humans, so seeing all those stories or people arriving in wheelchairs in the end because they've been in pain for so long that they sell an apartment or put their life savings in or take a loan out.
Try to lift and hold this. This doesn't bring pain?
No.
At the Geos Clinic, Jan is ready for home after borrowing £7,000 for a hip replacement and 7 days rehabilitation.
Okay, now push my palms, sorry.
I'd had to give up work as a baby nanny because it became too dangerous for me to work. I couldn't bear the thought of falling downstairs with a baby. It just worked out financially I'd be in a much better position if I just borrowed the money. The pain was becoming excruciating rather than wait until I'm end up in a wheelchair.
Paid up and a long way from Wales, Candy is next.
I've been worried sick, I haven't been sleeping, but the actual explanation I've had now, I just feel that there's hope at the end of this.
Her operation is tomorrow. It's easy to understand the angst of patients, but spare a thought for NHS GPs dealing with the backlog.
Today is a bit of a sad day. It's the end of 39 years of me being a doctor in this practice in Matlock. General practice is in the most difficult place I've known it in 40 years. We are now firefighting all the way down the line. The impact of waiting lists are that people keep coming back and keep coming back and keep coming back for the same problem. When we try and inquire from the hospitals as to what the waiting lists are, they won't tell us. We're doing about 30% more consultations than we were in 2019, with a smaller workforce. Incredibly demoralising, and it's one of the reasons I'm stopping being a principal.
75% of us consider the NHS one of Britain's proudest achievements, yet figures this week revealed less than a third of us to be satisfied with it.
They're waiting here to get onto a ward. 16 hours they've been waiting.
The Prime Minister told me it's his priority. We've witnessed record spending. In England, 2-year waits have fallen to around 1,000 cases, helped by 91 new ring-fenced surgical hubs.
Have a blink.
There's investment in the use of the latest technology, while GPs are delivering 500,000 more appointments. And in cancer, 94 new community diagnostic centres help check a record 2.8 million of us for cancer.
On funding, are things actually getting better or worse?
There's record funding insofar as more money at the moment is going into the NHS than there used to be, which of course is very welcome. But this follows a sustained period of underinvestment. Secondly, the number of vacancies currently in the NHS, I think it's around 10% at the moment. Without filling these vacancies, it's going to be impossible to get these people off the waiting list.
Now, girls.
Sadly, not everyone taken off the waiting list got the operation they needed. Some die. Others, like this dairy farmer, are now too weak to be treated.
What are you all doing? Hey, get a bit close.
In 2021, I made this report on Winston.
This is not for the squeamish, obviously, but
He'd already waited nearly 2 years for a routine hernia operation. It grew from the size of a fist to this.
I was classed as not urgent. Well, if this isn't urgent, what is, you know?
Today, 18 months on, and we've found Winston in a care home.
Sometimes I end up bent double, but never mind.
The hernia operation never happened.
In an ideal world, I should have been seen to. Well, it didn't happen.
Winston finally found the money to go private, but the surgeon said it's now too late. Inoperable, because it's been allowed to grow so large.
They say the size of it prohibits them from doing it. I have deteriorated. The operation would give me a 58% chance of dying. That's why they don't really want to do it. It's not getting in there.
The hernia has fractured Winston's spine and left him fighting for breath in a care home, paid for by the NHS.
But I shouldn't be in this position. It's all because it wasn't done in the first place. And it's grown and grown and grown. And it's revolting.
His greatest hope is to get back to the farm.
For the time being, God, this is my home. It's nice, but it ain't me. I can't smell cows. I can't smell grass. Dear God, where do we go from here?
In the summer of 2021, Mid Cheshire Hospital Trust told us we would like to apologise once again for the delays Winston experienced. But now the Trust tell us, due to his complexities, it is unlikely that he would have been suitable for treatment even without the delay in his assessment. We will continue to support Mr. Baldwin. In Derby, GP Peter Holden has witnessed too many lives darkened by delays.
When you'd referred them at a time when they were operable, they become inoperable because they're not fit enough to stand the anaesthetic or the surgery. That then means that patient has got years of discomfort. Their quality of life goes to the floor. Then they're consulting you because they're depressed. Then they're consulting you because they can't cope. And so you get into this vicious, ever-tightening downward spiral when a stitch in time would have saved 9.
For just about all of those who are told to take a ticket and join Britain's longest ever waiting list on record, there is frustration, pain, and as we've seen, lives on hold. But when it comes to cancer care, delays could also be a matter of life and death.
Tumours don't wait, they progress.
Professor Pat Price is worried. The NHS is failing by its own targets.
So they should be having their treatment within 62 days of having first presented.
But latest figures reveal almost half, 46%, waited longer. The target hasn't been met for 7 years. The most recent are the worst on record.
That target is there for a reason. International data shows that for every 4-week delay in diagnosis and treatment, there can be on average a 10% increase in death rate.
Given the delays, we're going to see a large rise in the number of people dying.
Absolutely. Tens of thousands of people are going to die.
The NHS say they are making progress. 19,000 now waiting longer than 2 months, down 14,000 on last summer. These are the cruelest of statistics for mother of 2, Maria.
I think my biggest fear was when I was first diagnosed, the first thing that came to my mind was, am I going to lose my hair? Which I obviously have.
Weeks turned to months as Maria struggled to see her GP and get emergency NHS tests as her vomiting and coughing got worse.
I tried to make an appointment, but they refused to see me. Over the course of 2 months, I was prescribed 4 lots of antibiotics. They weren't working for me.
When did you first see them face to face?
2 months later. She could see I wasn't well, but her suggestion was I should have emergency bloods done, which would be 3 weeks.
waiting.
That's an emergency
That's an
appointment.
emergency. I was obviously besides myself at this point. So I actually asked her to write me a referral so I could see somebody privately. I just literally picked one. And it was my saviour.
Tell me about your first appointment with your consultant.
He just said my bloods were back and they were dangerous. He said I had no time to go home to even get any belongings, and I had an MRI, and within a day I was diagnosed with stage 4B cancer.
What sort of impact do you think that delay had on you?
Well, my oncologist has already said that if I'd waited for the GP to have these emergency tests, I wouldn't be here to tell my story.
It's hard to ever prove Maria's lost weeks changed her odds, but losing faith in the NHS hasn't come cheap.
Every 3 weeks for chemo, I think we're looking at a bill of around 12,500.
At least Maria's father had family health insurance to pay the bills. Many have no such cover.
I wonder if you might clear something up as well for viewers who might not understand the way it works. If they were to go private and get a private diagnosis, can they then jump back into the NHS and be treated on the NHS?
That often happens because people can't afford necessarily the treatment on the private sector. But that then gets very messy for their care, because again, if they've got their diagnosis, but if they're coming back into an NHS system where there's a treatment wait, it's so unsatisfactory.
So we're simply diagnosing more people who then go and sit on another waiting list?
Correct.
An NHS spokesman said every corner of the NHS is working incredibly hard to deliver for patients. There has been significant progress in bringing down the longest waits for care. Back in Lithuania, Candy's hip replacement is underway. Not everyone thinks this long-distance solution is without risk.
If patients go abroad, we're concerned that the quality might not be so good. Find out as much as you can and just don't do it on immediacy and cost alone. Research really well.
These Lithuanian surgeons argue they are just as good, half the price, with better rehabilitation.
It's not an easy decision for patient to take to travel abroad, but they feel desperate because they cannot get help.
Super, you're getting up better.
Within days of her operation, Candy's rehabilitation is underway.
Lithuania, I am so pleased it was an option. This is the first step to recovery, and what a big step, a very big step. I'm off.
Independent experts predict the 7 million waiting list won't fall substantially until the middle of next year. It seems many more will be making journeys like this. Christina's fundraising paid off. Pain-free, she returned to the stage. Maria's looking forward to an Easter reunion with her sister from Cyprus. Jan is back at work as a nanny. And Candy made a full recovery, even teaching Lithuanian medics to line dance.
If you'd like more information, please visit our website, itv.com/tonight. And if you'd like to continue the conversation, you can use the hashtag ITVTonight. But for now, good evening, and thank you for watching.